What if the very pills sitting quietly in your kitchen cabinet right now were placing extra pressure on your heart every single day without you noticing it at all? And what if one of those medications was something millions of adults over 60 take every single week, believing it is completely harmless? Before we begin, I want you to do something important. If you care about your health or someone you love is over 60, take a second to like this video and subscribe, because the information you hear today might answer questions nobody has ever explained clearly before. And while you listen, leave a comment telling me your age and how many medications you currently take each day. You would be surprised how many people realize they are not alone after reading those comments. Now, let me be very clear from the beginning. This is not a video telling anyone to suddenly stop their medications. That would be dangerous and irresponsible. This conversation is about awareness, because one of the biggest problems I see in older adults is not always disease itself. Sometimes it is the silent combination of medications piling up year after year, while nobody stops to ask whether those same drugs are still affecting the body the same way they once did. At 40, your body processes medicine differently than it does at 70. At 70, your kidneys filter more slowly. Your liver breaks down chemicals differently. Your blood vessels become more sensitive. Your heart reacts differently to changes in blood pressure and fluid retention. And suddenly, a pill that caused no issues 20 years ago may now quietly increase the risk of stroke, irregular heartbeat, or even heart attack. That is the part many people never hear about. I remember speaking with a man named Richard. He was 72 years old. He walked every morning. He rarely missed a medical appointment. He believed he was doing everything right. But his blood pressure stayed dangerously high, no matter how many medications doctors added. One day during a routine conversation, I asked him something simple. "Richard, what over-the-counter medications do you take every week?" He shrugged and said nothing serious. "Just pain relievers for my knees. A little cold medicine when allergies get bad. Something for heartburn after dinner." That was the moment everything changed. Within weeks of adjusting those medications carefully with his physician, his blood pressure finally began to improve. Not because his heart suddenly changed, because the hidden pressure on his cardiovascular system had finally been recognized. And that is why this conversation matters so much. Especially if you are over 60. Especially if you take multiple medications. Especially if you assume over-the-counter automatically means safe. Because some of the most common drugs in America can quietly affect circulation, heart rhythm, blood pressure, and fluid balance in ways many people never realize until a serious event happens. And the second medication on this list is something millions of people receive every single year without hesitation. So stay with me all the way to the end, because what you learn today could help protect not only you, but somebody you love deeply. Let us begin with number 5. Pain relievers known as non-steroidal anti-inflammatory drugs. Most people do not recognize the medical name, but you absolutely recognize the products. Ibuprofen, naproxen, Advil, Motrin, Aleve. For many older adults, these pills become part of everyday life. Knee pain, back pain, shoulder stiffness, arthritis, headaches, aching joints after gardening. People take them because they work quickly, and because they are sold everywhere, many assume they must be harmless. But that assumption can become very dangerous after 60. What shocks many people is how strongly these medications can affect blood pressure and circulation. You see, these drugs can cause the body to retain extra sodium and fluid. That extra fluid forces the heart to work harder. Blood pressure slowly climbs. Blood vessels experience more stress. And for someone already dealing with hypertension or cardiovascular disease, the risk becomes much more serious. Research published over the years has repeatedly linked long-term or frequent use of these medications with increased risk of heart attack and stroke in older adults. And sometimes the increase is not small. I once cared for a woman in her late 60s who kept waking up with swelling in her ankles. Her blood pressure medications were already strong, yet her numbers refused to improve. After a detailed conversation, we discovered she had been taking ibuprofen nearly every day for arthritis pain in her hands. Nobody had connected the dots before. Within a short period after adjusting her pain management plan under medical supervision, the swelling decreased and her blood pressure improved significantly. Now imagine how many people never realize the connection at all. That is the frightening part. The medication helping one problem may quietly worsen another. And many older adults never feel warning signs until the damage has already started. That is why awareness matters so much. Now, of course, pain is real. Arthritis is real. Chronic discomfort can destroy quality of life. Nobody is pretending otherwise. But there may be safer approaches worth discussing with your physician. Sometimes topical treatments help reduce systemic effects. Sometimes physical therapy improves mobility. Sometimes lifestyle changes reduce inflammation naturally. Even simple daily walking routines can gradually improve joint stiffness in ways people do not expect. And this becomes especially important if you already have heart disease, kidney problems, or high blood pressure, because your cardiovascular system after 60 is simply less forgiving. Now here is where things become even more surprising. The next category of medication is often taken during something as ordinary as a cold, a stuffy nose, seasonal allergies, sinus pressure. Most people never imagine these products could create dangerous cardiovascular stress. But they can, and for certain adults the risk becomes very serious very quickly. I am talking about decongestants. You know the names: pseudoephedrine, phenylephrine. Many cold and flu medications contain them. People take these drugs hoping to breathe more easily. And technically they do work by shrinking swollen blood vessels inside the nose. The problem is they do not only affect the nose, they tighten blood vessels throughout the entire body. That means blood pressure can rise rapidly. For a younger, healthy adult, this temporary increase may not create major issues. But after 60, things change. Especially if someone already has hypertension, heart disease, circulation problems, or previous stroke risk. Suddenly, a common cold medicine may place enormous strain on the cardiovascular system. I remember one patient who arrived at the emergency room terrified because his heart was pounding violently late at night. His blood pressure had skyrocketed. He believed he was having a heart attack. After evaluation, we discovered something surprising. He had been taking over-the-counter cold medicine every 4 hours for severe congestion. He never imagined the medication could affect his heart that way. Nobody had warned him. And stories like this happen far more often than people realize. What makes this even more frustrating is that many people assume products behind the pharmacy counter must automatically be carefully controlled and harmless. But powerful medications remain powerful even when sold without prescription. And older adults process those medications differently. That is the part advertisements never mention. The body becomes more sensitive with age. Blood vessels become less flexible. The heart works harder under stress. Kidneys remove drugs more slowly. Everything changes. Now, this does not mean every decongestant is dangerous for every person, but it absolutely means older adults should not casually take these products without understanding potential cardiovascular effects. Especially if they already take blood pressure medication, especially if they have history of heart disease, especially if they experience palpitations or irregular heartbeat. Sometimes safer options exist: saline sprays, steam inhalation, humidifiers, hydration, rest. Simple approaches may help reduce congestion without placing extra strain on the cardiovascular system. And honestly, many people are shocked when they realize how often their symptoms improve with these alternatives alone. Now, before we continue to the next medication category, I want to pause for one moment because this next section becomes even more important. If you have ever taken medication daily for heartburn or acid reflux, stay with me carefully because millions of older adults use these drugs continuously for years, believing there is absolutely no downside. And what researchers later discovered surprised even many physicians. But before we continue, if anything in this video has already opened your eyes, quietly share this with someone you care about. A brother, a parent, a spouse, a friend over 60, because sometimes one conversation changes the way someone looks at their health forever. And before you forget, leave a comment below telling me which medication category surprised you the most so far. Part 2 will continue with one of the most commonly used medications for acid reflux, and why long-term use may affect the heart in ways many people never expect. Now let us talk about a medication category that millions of people take almost automatically after meals. Heartburn after dinner, burning in the chest at night, acid reflux while lying down. For many older adults, these symptoms become so common that taking a pill feels as routine as brushing their teeth. And that is exactly why this next medication category deserves serious attention. I am talking about proton pump inhibitors. Many people know them by brand names or familiar prescriptions. Omeprazole, pantoprazole, esomeprazole, lansoprazole. These drugs reduce stomach acid and can absolutely be helpful when used properly. In certain situations, they are extremely important. Severe acid reflux, bleeding ulcers, damage to the esophagus. Doctors prescribe them because they can provide real relief. But here is where the problem begins. These medications were generally designed for shorter periods of use. Yet millions of adults remain on them for years, sometimes decades. And many never stop to ask whether long-term use may be affecting the rest of the body in ways they cannot feel immediately. I once met a retired teacher named Eleanor who had been taking acid reflux medication for nearly 12 years. She told me something I hear all the time. I thought if doctors kept refilling it, it must be perfectly safe forever. That assumption is incredibly common. But over time, researchers began noticing patterns. People using these medications long-term appeared to experience higher rates of cardiovascular issues and mineral deficiencies that could indirectly affect the heart. One important reason involves magnesium. Most people never think about magnesium until something goes wrong. But magnesium plays a critical role in maintaining healthy heart rhythm and proper muscle function. Long-term use of certain acid-reducing medications may interfere with magnesium absorption in some individuals. And when magnesium levels fall too low, problems can begin quietly. Heart palpitations, muscle cramps, weakness, irregular heartbeat, fatigue. Sometimes people visit doctors repeatedly without realizing their medication may be contributing to the issue. There is another concern researchers have explored as well. These medications may affect nitric oxide pathways involved in blood vessel relaxation. Nitric oxide helps blood vessels remain flexible and open. When those systems become disrupted, blood vessels may not function as efficiently. That places additional stress on circulation and heart function over time. Now let me be careful again. This does not mean nobody should ever take these medications. That would be irresponsible to suggest. Some people genuinely need them. But what matters is awareness and periodic reevaluation. Does someone still need the medication? Could the dose be lower? Could lifestyle changes reduce symptoms naturally? Those are smart conversations worth having with a healthcare professional. And sometimes the simplest changes make an enormous difference. Avoiding heavy late-night meals, reducing alcohol, sleeping with the upper body slightly elevated, managing body weight, avoiding foods that trigger reflux. Many people discover their symptoms improve dramatically after small adjustments. But because pills are easier and faster, those conversations often never happen. That is the larger issue we need to talk about. Modern life trains people to silence symptoms quickly. Pain, take a pill. Heartburn, take a pill. Congestion, take a pill. Trouble sleeping, take a pill. And while medications absolutely have important medical value, every additional drug adds another layer of complexity to the body, especially after 60. Especially when multiple medications interact together. And that brings us to number 2. This one surprises many people because it is prescribed constantly for infections, sinus infections, bronchitis, respiratory illnesses, dental infections. Millions of prescriptions every year. I am talking about certain antibiotics, especially macrolide antibiotics like azithromycin. Many people know it as the famous 5-day treatment pack doctors frequently prescribe. Patients often love it because it feels convenient, simple, fast, and effective. But hidden beneath that convenience is something many older adults never hear about. Certain antibiotics can affect the electrical system of the heart. Now this becomes extremely important after 60 because aging hearts are often already more vulnerable to rhythm disturbances. Some people already have hidden cardiovascular disease without realizing it. Others take medications that also affect heart rhythm. And when these factors combine, risk increases significantly. One older gentleman once described feeling sudden fluttering in his chest shortly after starting an antibiotic for bronchitis. At first he ignored it. Then came dizziness, weakness, a strange sensation he could not explain. Fortunately, he sought medical care quickly. Doctors later discovered his heart rhythm had become dangerously unstable. Now again, I want to be responsible here. Most people who take antibiotics do not experience severe complications. But awareness matters because certain individuals carry much higher risk than they realize, especially older adults with existing heart disease, especially people taking multiple medications, especially those with prior rhythm abnormalities. Some antibiotics can prolong something called the QT interval. That is essentially part of the electrical recovery cycle between heartbeats. When that timing becomes excessively prolonged, dangerous arrhythmias may occur. And the frightening part is that many people feel completely normal until the rhythm suddenly becomes unstable. That is why medication interactions matter so much. One prescription alone may not create major issues, but several medications together may quietly increase risk in ways nobody notices immediately. This is exactly why older adults should always keep an updated medication list. Prescription drugs, over-the-counter pills, supplements, everything. Because sometimes the interaction between medications becomes more dangerous than the medications themselves. And this next point is critical. Never assume every doctor automatically sees the full picture. Different specialists may prescribe different medications. One physician treats blood pressure, another treats pain, another treats reflux, another prescribes antibiotics. Meanwhile, the patient may end up taking 10 or 15 substances interacting inside the same body every single day. That is why patients must become active participants in their own healthcare, not passive observers. You deserve to ask questions. Do these medications interact? Are there safer alternatives? Do I still need this medication after all these years? Could this affect my heart rhythm or blood pressure? Those are intelligent questions, and honestly, many doctors appreciate patients who ask them. Because good medicine should always involve conversation and reevaluation, not blind continuation forever. Now I want to pause here for something important. If you are still watching, it means you genuinely care about protecting your health or helping someone you love stay healthier longer. So take 1 second and subscribe to the channel, because these conversations are designed to help people notice dangers most never hear explained clearly. And if you have a family member over 60 who takes several medications daily, send this video to them before you forget. It could start a conversation that changes everything. Also tell me in the comments what country you are watching from and whether you have ever experienced side effects from medication that nobody warned you about before. Because what we are about to discuss next may be the most emotionally sensitive topic in this entire video. And also one of the most important. The #1 medication category associated with overlooked heart risks in older adults involves drugs millions rely on for emotional well-being, chronic pain, sleep issues, and anxiety. And the truth behind it is far more complicated than most people realize. Part 3 will continue with the final medication category and the hidden reason why aging hearts become far more vulnerable to medication interactions over time. Now we arrive at the final category, and I want to approach this carefully because this subject affects millions of people personally. Depression is real, anxiety is real, loneliness in older age is real. Chronic emotional stress can absolutely affect physical health, sleep quality, blood pressure, and even the immune system. So nothing in this conversation is meant to shame anyone for seeking help. In fact, untreated depression itself can increase cardiovascular risk over time. But what many people do not realize is that certain antidepressant medications may affect the heart differently, depending on age, dosage, medical history, and interaction with other drugs. And after 60, those differences matter much more. Some older antidepressants known as tricyclic antidepressants have been associated with effects on heart rhythm, blood pressure, and circulation. Medications in this category are sometimes still used not only for depression, but also for chronic pain, insomnia, nerve pain, and migraines. That means some people taking them may not even realize they belong to the antidepressant family. One woman told me she had been using a medication for sleep for nearly 8 years before learning it could influence blood pressure and dizziness when standing up. She thought her balance problems were simply part of aging, but after a careful medical review, her treatment plan was adjusted and the dizzy spells improved dramatically. That is why these conversations matter. Because symptoms people blame on old age are sometimes connected to medications quietly affecting the body every single day. Now, certain antidepressants may also influence electrical activity in the heart. And as we discussed earlier with some antibiotics, disturbances in heart rhythm become more dangerous in older adults, especially when multiple medications with similar effects are combined together. That combination risk is what worries many physicians most, not necessarily one medication alone, but layers upon layers building silently over time. And there is another hidden issue many people never consider: falls. Some medications may lower blood pressure suddenly when standing up. Others cause sedation or slower reaction time. For an older adult, one fall can completely change life overnight. Broken hips, hospital stays, loss of independence, fear of walking confidently again. All from something that may have started with medication side effects nobody recognized early enough. I remember speaking with a widower named Daniel who began taking several medications after losing his wife. One for sleep, one for anxiety, one for pain, another for blood pressure. He told me he constantly felt exhausted and mentally foggy. At first, he believed grief alone was causing everything. But after a detailed medication review with his physician, several adjustments were made carefully and gradually. Months later, he said something I never forgot: "I finally feel awake again." That sentence stayed with me because so many older adults slowly begin accepting fatigue, dizziness, weakness, and mental fog as normal aging when sometimes medications are contributing far more than anyone realizes. Again, this is not about fear. It is about awareness. And awareness becomes incredibly important after 60 because the body becomes more vulnerable to cumulative stress. Think about it this way. Every medication has effects beyond its primary purpose. One may increase fluid retention, another may raise blood pressure, another may alter heart rhythm, another may increase bleeding risk, another may affect kidney function. Individually, those effects may seem manageable, but together they create a much more complicated picture. And that is why medication reviews become so important for older adults. Not once, regularly, at least once or twice a year, especially if multiple prescriptions are involved. Now let us step back and look at the bigger picture for a moment. Modern medicine has done incredible things. People live longer than previous generations. Many diseases once considered fatal are now manageable. Medications save lives every single day. But there is also a growing problem many families quietly experience. Polypharmacy. That means taking many medications simultaneously. And the older someone becomes, the more common this situation becomes. One pill for cholesterol, one for blood pressure, one for sleep, one for reflux, one for pain, one for anxiety, one for blood sugar, one for inflammation. Soon the body is processing a long list of chemicals every single day. And sometimes nobody pauses long enough to ask the most important question. Do I still truly need every single one of these? That question can be life-changing. Because sometimes medications prescribed years ago continue automatically without reevaluation. Sometimes the original problem improved long ago. Sometimes lifestyle changes could reduce dependence on certain drugs. Sometimes doses should be adjusted with age. But those conversations only happen when patients become active participants in their healthcare. You deserve to understand what enters your body. You deserve explanations. You deserve conversations about risk versus benefit. You deserve doctors who listen carefully when symptoms change. And you deserve to know that feeling constantly tired or mentally cloudy should not automatically be dismissed as simply getting older. Now here is something else people often overlook. Lifestyle still matters enormously. Walking regularly, sleeping properly, managing stress, eating nutrient-rich foods, staying socially connected. Those habits sound simple, but they directly influence blood pressure, inflammation, circulation, mood, and overall cardiovascular health. I once knew an older couple who began walking together every evening after dinner. Nothing extreme, just 30 minutes around their neighborhood. Within months, both experienced lower blood pressure, improved sleep, better mood, and more energy. Their doctor later reduced some of their medications carefully because their health markers improved naturally. That story matters because many people feel powerless once they reach older age. But the human body still responds to healthy habits remarkably well even later in life. And honestly, some of the strongest medicine for the heart is not found inside a bottle. It is found inside daily routines repeated consistently over time. Fresh food, movement, connection, sleep, sunlight, purpose. Those things matter more than many people realize. Now, before we finish, I want you to do something practical after this video ends. Go gather every medication you currently take. Prescription medications, over-the-counter pills, supplements, everything. Write them down carefully. Then at your next medical appointment, bring that list and ask direct questions. Do all of these still make sense together? Could any affect my heart or blood pressure? Are there safer alternatives? Should any doses be adjusted because of my age? Could any interactions explain symptoms I have been ignoring? Those questions may reveal more than you expect. And if you are caring for aging parents or grandparents, help them review their medications too. Many older adults feel overwhelmed by complicated prescriptions and never speak up because they trust the system completely. Sometimes they simply need someone patient enough to help organize the conversation. Now, if this video helped you see medications differently, take one moment to share it with somebody you care about. A brother, a sister, a parent, a friend over 60. You never know whose life may change because of one conversation started at the right time. And before you leave, write a comment telling me your age and which medication category surprised you most today. I read those comments carefully because they help other viewers realize they are not facing these concerns alone. Also, subscribe for more health conversations designed to help you stay informed, independent, and strong as you grow older. Because getting older should never mean becoming passive about your health. The more informed you become, the more empowered you become. Take care of your heart. Take care of your mind. And most importantly, take care of yourself and the people you love.